Hi, it's Audrey from Holistic Wellness RN. This is a research project I recently completed for one of my nursing courses that I wanted to share with you. There is evidence-based research that shows Reiki treatments are both therapeutic and beneficial. Reiki is a Japanese-based healing modality, and it's a form of energy healing that was created by Dr. Mikao Usui. It's based on accessing the universal life energy. It is a hands on healing technique. Reiki is not a religion. What Reiki does is balances and clears the energy centers of the body called the chakras. In the picture, the seven chakras are listed from bottom to top is the root chakra, sacral chakra, solar plexus chakra, heart chakra, throat chakra, third eye, and crown chakra. Reiki works on the emotional and spiritual levels of our being, and Reiki sessions can facilitate a change of consciousness in the patients receiving the treatments. The first article is titled Reiki is Better Than Placebo and Has Broad Potential as a Complementary Health Therapy. This particular research design was a systematic review of 13 studies, and it did show that Reiki was better than a placebo for inducing a state of relaxation in patients. Reiki is suitable for babies, children, and the frail elderly, and it was found to be effective in activating the parasympathetic nervous system. It has potential to provide support for a broad range of chronic health conditions. There is some skepticism by many people about Reiki and the ability of a Reiki practitioner to confer healing through hands, which is why it's great to find evidence-based research of the beneficial and therapeutic results of receiving Reiki. Further research is needed to examine the benefits of multiple Reiki sessions over an extended period of time. The next article is titled The Effect of Reiki on Depression in Elderly People Living in a Nursing Home. This research design was randomized, controlled, and experimental. Statistics show that depression increases in prevalence during the mid-60s. This research also demonstrated that during Reiki sessions, the parasympathetic nervous system's activity was increased. This resulted in decreased cortisol levels, decreased heart rate and blood pressure, which resulted in a state of relaxation. Significant decrease in the depression scores of those that received Reiki treatments versus those that did not was demonstrated by this study. This article was titled The Effect of Reiki on Pain, a Meta-Analysis. That was the type of research design, a meta-analysis. We all know that pain can lead to psychological, mental, and physiological problems. This study contained 4 randomized controlled studies of 212 participants. The end result of this study showed that receiving Reiki caused a significant decrease in the VAS scores. The VAS is the visual analog scale that practitioners use to measure a patient's pain. This article was titled Mental Health, Wellness, and Biofield Therapies and Integrative Review. The research design was an integrative review using a deductive-inductive approach. It reviewed 30 studies. Highlights of this study showed that intrinsic to mental health is the mind-body connection. Over 1/3 of adults in the U.S. use mind-body practices. Wellness is defined as an integration of our physical, emotional, mental, spiritual, social, occupational, and environmental dimensions of self. The results of this study showed that Reiki improved relaxation, anxiety and worry, mood, attitude, and loneliness isolation in cancer patients. The title of this article is Energy Healing and Effective Non-Pharmacological Therapy for Improving Symptom Management of Chronic Illnesses, a Systematic Review. That is the research design of this study, a systematic review. It reviewed 27 studies evaluating energy healing interventions. Studies reviewed include adults with cancer, chronic pain, chronic illness, and arthritis. 13 of the 27 studies generated statistically significant outcomes. The results showed energy healing has the potential to facilitate personal growth through a deeper connection to the spiritual aspects of life. The recommendation is for further controlled trials and mixed method studies. This article is titled Energy Medicine, Current Status and Future Perspectives. This research design was an integrative literature review. The results showed that future of energy medicine depends on the ability of allopathic medicine to merge physics and biochemistry. We know quantum physics shows us there is no difference between energy and matter. Physics must be blended with biochemistry to treat the human being without adverse effects. We already have tools that measure different types of energy, such as X-rays, MRIs, EKGs, and ECGs. The results of this study shows that each of our body systems is a channel for energy communication. This concludes my research of the therapeutic and beneficial effects of Reiki. These last two slides are my references. And I thank you for watching, and I encourage you to go schedule a Reiki appointment and experience the benefits of a session for yourself. Thank you.